Hey, it's Dr. Joe here with Colopy Chiropractic. We're working with this patient today with some low back pain and the occasional migraine headache, which she's noticed great results since with care in getting those migraines gone or shortened in duration and intensity, and same with the low back issues. So we're going to go ahead and work on her today. Tell me, is there any difference between the right side and the left side?
Mm-hmm.
Right worse or left worse?
Right.
Worse, okay. And then when I press there versus there? Equal. What about if we press there versus there?
The right.
Right. Okay, go ahead and turn on your back for me. And be below that break in the table. We're going to bend this right leg. Again, we're going to address any rotation that we find in the hips and the sacrum first. Good. Relax that leg and bend this one. One more time. Good. Now you can turn over on your stomach. When I squeeze the calves, is there any difference between the right and the left? Equal? Good. Now we're going to keep that leg straight. Lift your left one as high as you can. Good. Relax down. Try your right side. Good. Any difference? Equal?
They feel equal, actually.
Good. Alright, let's turn it face me this way on your side. Up a little more. And then if you lay on your back, cross our arms, breath in, all the way out. So that adjustment is to open up the shoulders, to allow some of the roundness in the shoulders to open up. It takes a lot of tension off the neck in the back of the shoulders. Especially with someone that has migraines, we always want to make sure not only that we address any misalignments in the neck, but also in the upper back too. And all those muscles that can create tension in the back of the head, they go down and they attach, anchor all the way in the mid-back. And come on up.